Hello, future nurses. Welcome to our review session on the management of care. And in this session, we'll focus on the essential nursing responsibilities that ensure safe, effective, and ethical patient care. Also, mastering these concepts is key to your success on the NCLEX and in your future clinical practice. And so today we'll cover patient assignment and delegation, advanced directives, and durable power of attorney for healthcare, against medical advice, discharge planning, patient rights and informed consent, effective communication and handover, prioritization and time management, HIPAA and patient confidentiality, documentation, nursing management, and leadership. Also, don't forget to subscribe to this channel and a thumbs up for this session. Let's go ahead and do the Q&A. Question number 1. At the start of a shift, a registered nurse working on a medical surgical floor assigns tasks. Which of these duties should the RN assign to a licensed practical nurse? Options: A, instruct the client on proper wound care management before discharge. B, check the vital signs of a client who underwent a cardiac catheterization 2 hours earlier. C, formulate a care plan for a client just admitted with pneumonia. D, provide a cancer patient with a transfusion of packed red blood cells. The answer here is letter B. Check the vital signs of a client who underwent a cardiac catheterization 2 hours earlier. Now, going back into the question stem, you as the RN have to delegate the tasks, and you got to make sure that each team member is working within their scope of practice. Now, why is letter B a correct option? Well, review that the LPNs can handle routine monitoring tasks for stable clients. And this client in option B had a cardiac catheterization 2 hours ago. But at this point, they should be stable unless complications arise. And the LPN can take vital signs and report any concerning changes. Let's say a sudden drop in the blood pressure, or let's say a new chest pain to the registered nurse. So this is a perfectly appropriate task for an RN. Now, going back into the option, the main task here is to check the vital signs of a client. There's nothing else. All right. So don't go beyond what is being described in this option. Now, why is letter A is incorrect? It states instruct the client on proper wound care management before discharge. Now, I want you to go back into the concept of teaching, that it is not just about handing out instructions, but this requires assessment of what the client understands, also tailoring the education to the client's needs and their family members. And you also need to evaluate if they can do it properly. And so only a registered nurse can do the initial teaching. We know that the LPNs can reinforce what the RN already taught, but they don't create or provide new education, and that is why we are discarding this option. Now, what about letter C? Formulate a care plan for a client just admitted with pneumonia. No, this is also a registered nurse responsibility, because care planning requires critical thinking and a comprehensive nursing assessment, and both of which are only going to be done by the RN that is trained to do so. Now, the LPNs can contribute to the plan, they can observe the patient and suggest updates, but they cannot create or finalize the plan. That's why we are discarding this option. Now, let's look into letter D. Provide a cancer patient with a transfusion of packed red blood cells. Why is this incorrect? Well, this is a big no, because this is a task in an RN-only territory. And we know that giving blood requires careful monitoring for serious reactions. We have to catch for any occurrence of fever, maybe chills, or let's say difficulty breathing, or maybe a sudden drop in the blood pressure. And these reactions can be life-threatening, and the blood products must be administered by the RN. Now, for you to answer this question correctly, you have to remember about the scope of practice. The RNs can handle teaching, assessments, do the care plans, and also do complex procedures like blood transfusion. Whereas the LPNs can handle stable patients, they can do routine monitoring like vital signs checking, they can reinforce education, but not doing the initial teaching. And also you need to think about the patient's stability. The LPNs can take care of stable patients, but should not be assigned to new admissions or post-op clients in critical condition. I'm emphasizing critical condition, or those requiring complex care. And you have to eliminate anything that requires RN level decision making. And so if the task involves creating a care plan or making critical judgment, or let's say initial teaching or administering high risk medication, you got to cross it out. All right. This is, or these are an RN's job. And so the key here, especially when you are delegating, you have to match the right task to the right role while you're keeping patient safety in mind. And so if a question asks, can an LPN do this? You have to ask yourself, is the patient stable? Does this task require teaching? Does this require assessment? Or does this require critical thinking? Or would this put the patient at risk if something goes wrong? And so when you follow these steps, you're going to be able to select the correct option. Let's have 2. The charge nurse in the medical surgical unit is responsible for managing 4 new patient admissions. The emergency room is sending a patient with high blood pressure and worsening heart failure, plus a patient with pneumonia and a past diagnosis of diabetes. The post-anesthesia care unit is transferring a patient after a total abdominal hysterectomy and another following hip surgery. With a team of 2 RNs, the second nurse who is still on orientation, and 2 LPNs, LVNs, what would be a suitable task assignment? Options. A, an LPN, LVN will care for the patient who had the abdominal hysterectomy. B, the RN in training will take the patient who had hip surgery. C, an LPN, LVN will look after the patient with pneumonia and a diabetes history. D, the seasoned RN will manage the patient post-hip replacement. Now, what is your choice here? Well, this question is testing your ability to delegate tasks safely based on the team member's skill level. And on the NCLEX, delegation must always prioritize patient safety, and you have to match the right nurse to the right patient. So the answer here is letter D. And why is that? Well, fresh post-op patients are high risk. They need frequent assessments for complications like bleeding, infection, and shock. And the experienced nurse is best suited for handling unstable patients, especially those recovering from major surgeries. And this RN will also oversee the post-hysterectomy patient, and both are at risk for serious complications. And so the RN in training can focus on stable medical patients, for those patients that had hypertension and diabetes, and so they can gain experience while being supervised. And we have letter A as one of the incorrect options. Why is this incorrect? Well, a fresh post-op patient is not stable enough for this LPN or LVN, and there is a high risk for low blood volume. There's a risk for bleeding or infection. This will require frequent assessments and quick interventions. Also skills that fall under the registered nurse scope. And the LPNs can assist with the routine care, dressing changes, vital signs checking, medication administration under the RN supervision, but they cannot be responsible for high-risk surgical patients. So bottom line here is that the LVNs, LPNs should not be assigned to unstable post-op patients, fresh post-op, because they lack the training for complex assessments. Now, what about letter B? Why is this incorrect? Well, this is talking about the RN still on orientation, right? This RN is not ready to manage a high-risk post-op patient alone. And post-operative patients need experienced judgment for pain management, mobility assistance, and monitoring for blood clots or infection. And so the RN that is still in orientation should instead take on stable medical cases where they can learn and be supervised by a seasoned RN. Now, why is letter C also incorrect? It states an LPN LVN will look after the patient with pneumonia and a diabetes history. Well, pneumonia is an acute condition that can worsen quickly. It requires oxygen therapy and frequent monitoring. And diabetes complicates recovery. And this increases their infection risk, and also it requires close glucose control. And the LPNs, LVNs can assist with care, but should not be the primary nurse for an unstable medical patient. And the RN should assess and adjust the treatment plans. And for you to answer this question, you have to match the right patient to the right nurse. So the experienced nurse should take the high-risk post-op patients, such as the one with a hip surgery, hysterectomy. The RN that is still doing the orientation can take more stable medical cases such as hypertension, diabetes, whereas the LPNs, LVNs can take stable patients needing basic care, vital signs, dressing changes, helping with ADLs. You also need to avoid assigning unstable or complex patients to the LPNs because they cannot perform independent assessments or make critical decisions, and they work best under an RN supervision, and they can help with routine tasks. And also think about the supervision and safety. And so the new RN should not be assigned a high-risk patient alone. And a post-op patient requires an RN with strong assessment skills, and that's why we're not gonna select letter B. So again, who needs the most experienced care? Well, of course, those patients that are post-op, unstable, or high-risk patients. And if you are going to ask who can safely manage stable medical patients, that should be the RN in training, and the LPNs can take those patients that will require routine care, vital signs, and ADL. So I hope that you got this item correctly. 3. As a licensed practical nurse finishes their shift, they inform the registered nurse that a recently onboarded assistive personnel has failed to record the fluid intake and output for multiple clients. What steps should the RN take next? Options: A, assign this responsibility to the LPN. B, inquire whether the assistive personnel requires help with the task. C, report the issue to the nurse supervisor. D, fill out an event report form, or what we call as incident report. The answer here is letter B. Inquire whether the assistive personnel requires help with the task. So, what should the RN do about the assistive personnel's mistake? So, this question is about handling delegation issues and also managing team members effectively. And so, when an assistive personnel is not doing their job properly, the registered nurse has to step in, will have to assess the situation and correct it appropriately. Now, why is letter B correct? Well, it's because the registered nurse's role is to oversee the nursing team and should ensure tasks are being done correctly. And before assuming the assistive personnel is neglecting their duties on purpose, the RN should ask questions to find out if the assistive personnel does not understand the task or needs more training. And so this approach encourages problem solving. This also encourages teamwork and communication. Now, this is also the best step because it can help fix the issue at the source without unnecessary escalation. Now, why is letter A incorrect? Well, the LPN already did their job by reporting the issue to the registered nurse. It's not their responsibility to fix it. and the assistive personnel is responsible for recording intake and output. So the RN needs to correct the assistive personnel's behavior, not shifting the responsibility to someone else. And so remember that with delegation, it simply means that you are going to hold people accountable, not reassigning their tasks when they don't do them. Now, what about letter C? Why is this incorrect? This is basically not necessary, at least not yet, because the RN is in charge of managing the assistive personnel. And so if you're running to the supervisor too soon, it's going to make it look like the RN cannot handle basic delegation issues. And if the assistive personnel continues to neglect their duties after guidance, then it would be appropriate to report this one. And remember that good leadership means handling problems at your level first before you escalate. Letter D, why is this incorrect? Filling out an event report form. Well, this is such an overkill because incident reports are for serious safety incidents, such as medical errors or injuries. We know that failure to document intake and output is a problem, and it's something that can be corrected without an official report. And if this mistake has caused any harm, maybe a patient went into fluid overload because their intake wasn't monitored, then an event report would be needed. And you have to keep in mind that not every mistake requires paperwork. Sometimes just a conversation can also fix it. And so when you answer this type of question, you have to always assess before acting. And before assuming that a team member is being negligent, you have to figure out if they need help or more training. And the best first step is to communicate with the person involved before escalating the situation. And you have to keep the problems at the right level. So the RN in this case is responsible for managing the assistive personnel and the LPNs. And you don't jump to the supervisor unless the issue cannot be fixed at the RN's level. So you only escalate only if the problem is serious and the assistive personnel is ignoring the instructions after being corrected, and also when the patient safety is at risk. Also, another thing to keep in mind is do not pass the problem. You have to solve it. And remember that delegation is about accountability. And if someone isn't doing their assigned task, you can't just give it to someone else. You have to address the root of the problem. And good nurses don't just react. They're going to do the investigation, they communicate, and they do problem solving before escalating. Number 4, a nurse from the maternity unit floats to a medical unit to care for several seriously ill patients. Which set of patients should the charge nurse assign to this float nurse? Options: A, an elderly patient with pneumonia, a patient with worsening asthma, and a patient with a recent below-knee amputation. B, a patient with a previous stroke, a patient with 3 days post-hip replacement, and a patient with diabetic ketoacidosis. C, an elderly patient with dehydration, a patient with atrial fibrillation, and a patient newly admitted with broken hip. D, a patient 3 days post-total knee replacement, a patient recovering from colon surgery, and a patient who recently had a hysterectomy. The best answer here is, before we're going to go do that, this question basically is testing your ability to match the right nurse with the right patients. So, especially in this type of case scenario wherein there is a float nurse coming from a maternity unit, they should be assigned patients within their scope of practice and also their comfort zone in order to ensure safe and competent care. And that is why the correct answer here is letter D. Why? Because the maternity nurse is used to the surgical patients, especially those recovering from C-sections. And these post-op patients have predictable care needs like pain control, wound care, mobility assistance, and monitoring for complications, maybe infection, blood clots. And they don't require specialized knowledge of chronic illnesses or critical conditions, so making this assignment the safest match for this float nurse. Okay, so the key point here is that the float nurse should be assigned to patients with conditions similar to those they regularly manage in their home unit. And so we have options A, B, and C as incorrect choices. Let's go into letter A. Why is this incorrect? Well, we know that pneumonia and worsening asthma require frequent respiratory assessments, and also interventions like nebulizers, oxygen therapy, and monitoring for respiratory distress. And the amputation patient needs specialized wound care and mobility support that a maternity nurse may not be familiar with. And so the patients in option A with their conditions can worsen suddenly. These patients can require rapid interventions, and so making this assignment inappropriate for this float nurse. Now, what about letter B? Why is this incorrect? Well, take a look into the client here. We have a patient with a DKA, a patient with a previous stroke, patient that is 3 days post-hip replacement. And we know that DKA is a medical emergency. It requires frequent blood sugar checks, IV insulin adjustments, and fluid management. And so this is quite outside the maternity nurse's expertise. And the stroke patient may also need neurological assessments, mobility support, which require familiarity with rehabilitation and stroke protocols. And the hip replacement in option B needs post-op care, which the float nurse can handle. But the DKA and the stroke cases makes this assignment too risky for them. And so you have to avoid assigning float nurses to critical conditions like DKA. Now, what about letter C? Why is this incorrect? Well, with a case of dehydration in the elderly patient, this can cause confusion, it can cause kidney issues and sudden deterioration. And there's also a case here with atrial fib, which is a cardiac condition requiring frequent heart monitoring and also adjustment of their medications, such as anticoagulants, beta blockers. And a patient with a broken hip in option C is also unpredictable, and this patient will require frequent assessments and possible potential emergency interventions. And so the maternity nurse do not typically manage patients with heart conditions or acute elderly care. And so this is also inappropriate for them. And you have to keep in mind in avoiding this task, especially that these patients have unstable cardiac conditions, unstable admissions, and they also will be at a higher risk for rapid decline. So keep in mind about these considerations. So again, you have to match the float nurse to the familiar patient types. Again, they are comfortable with C-sections, post-op pain management and wound care, but they should not be assigned to unstable, critical, or rapidly changing conditions. So I want you to identify the red flags in the options. Again, take a look into those unstable conditions. We have a patient here that has DKA. We have a patient that has worsening asthma, also new admissions, and there's also a patient that is having atrial fibrillation, stroke history. Also take note about the complex wound care. There's that amputated patient. There's also that diabetic ulcers. And keep in mind that if a group of patients includes any of these, it's probably not the best choice for this maternity float nurse. Okay, so you have to keep in mind that the maternity nurse could manage a hip replacement, but not if the assignment also includes a high-risk patient. So you got to choose the most predictable, stable group that matches their experience. Now, what about number 5 here? A nurse is attending to a client experiencing chest pain who states, "I'm leaving right now." Which of the following steps should the nurse take? Select all that apply. Options: A, inform the client about the potential consequences of departing. B, contact the client's relatives to alert them of the client's plan to exit the facility. C, request that the client sign a document releasing the facility from liability. D, block the client from leaving until the healthcare provider is present. E, record the client's condition or decision to depart the facility against medical advice. So this scenario is about handling a client who wants to leave against medical advice. And this is testing your understanding of patients' rights, your legal responsibilities, and ethical nursing practice. Now, if a patient wants to leave against medical advice, your task is to respect their autonomy while you are ensuring they are informed, and you have to document the situation properly. And so we have the options A, C, and E as our best answers. Why letter A? Well, it's because the nurse has a duty to explain what could happen if the patient leaves. And in this case, chest pain could signal a serious issue. It could be a heart attack. And leaving without treatment could be life-threatening. And so when you inform the patient about the risk, this can help them make an educated decision. And also take note that patients have the right to refuse care, but your role as the RN, you have to ensure they understand the risks. Now, what about letter C? Why is this also correct? Well, this is what we call as the Against Medical Advice form, or AMA form. This is going to protect the hospital from the legal responsibility if the patient's condition worsens after they leave. And the patient signing this form shows that they were alert, they're aware, and they made the decision voluntarily. And if the patient refuses to sign, document that fact, and you should have a witness in order to also sign that they have witnessed that event. And so you have to keep in mind that the hospital cannot force someone to stay, but it can document that the patient was warned about the risks. Now, what about letter E? Recording the client's decision to depart the facility against medical advice. Why is this correct? Well, we know that the documentation can protect everyone. It will protect the patient, it will protect the nurse, the facility, and the nurse should include in their documentation what the patient said. And they stated, "I'm leaving now." You also need to document the risks that were explained. For example, you stated that I informed the patient of possible complications, and you have to document that in detail. And you also need to include whether the patient signed the AMA form. And so if the patient refuses to listen or sign anything, you have to document that as well. So the key point here is if it's not documented, it did not happen. Now, why is letter B an incorrect option? It says contact the client's relatives to alert them of the client's plan to exit the facility. Now, it is wrong because remember that with HIPAA, it prevents nurses from sharing patient information without the patient's consent. And even though you might think the family should know, the patient has a right to keep their decisions private. And also notifying the healthcare provider so they can attempt to intervene. So that's going to be your alternative. And also, the privacy laws comes first. You cannot tell the family unless the patient allows it. Now, what about letter D? Why is this incorrect? Blocking the client from leaving. Well, this is quite forcing a patient to stay. This is false imprisonment. And if you're holding a patient against their will, could lead to legal action against the hospital and the nurse. And the only time a patient can be stopped from leaving is if they are a danger to themselves or others. Let's say they're suicidal, they're violent or confused. and also under involuntary commitment. They are on psychiatric hold. And so the key point here is that if a patient is alert and oriented, they have the right to leave, even if it is a bad idea. And so your strategies in answering this question is to prioritize patient education over forcing compliance. Now, if a patient wants to leave, your first step is to inform them about the risks. Do not call family, do not involve security, or do not physically restrain them. Also, you have to document everything. And if the patient leaves, your notes should cover what was said, what risks were explained, and whether they signed the AMA form and any witnesses that are present during the event. And you have to think legally and ethically. You have to respect the patient's autonomy. The patient has the right to make their own decisions, even if they're bad ones. You have to protect privacy. Do not contact family without permission, and also avoid legal trouble. So blocking someone from leaving can be seen as an assault, or it could be false imprisonment. So in this kind of scenario, you have to balance patient rights with professional responsibility, and you as a nurse cannot force patients to stay, but should educate. You have to document and follow legal guidelines. Number 6, after contacting the healthcare provider about a patient experiencing indigestion, sweating, and an irregular cardiac rhythm, the nurse receives urgent orders for an ECG, blood tests for cardiac markers, morphine 2 milligrams IV push, nitroglycerin 0.4 milligrams sublingual, and aspirin 325 milligrams to chew and swallow. Which tasks can the nurse assign to others? Select all that apply. Options: A, performing the ECG, B, giving the prescribed medications, C, checking the patient's oxygen levels, D, drawing blood for the cardiac marker tests, E, reevaluating the patient's status. So this question is testing your ability to delegate appropriately in an urgent situation. And in the NCLEX, some tasks can be assigned to others, but critical nursing responsibilities must stay with the registered nurse. And so we have the options A, C, and D as correct options. Why letter A? Well, remember that EKGs or ECGs are procedural tasks that trained staff could include those ECG technicians. They can perform this, and the nurse doesn't need to personally attach the leads or run the machine. They just need to interpret the results later. And so the key point in this option is that nurse can delegate the ECG itself, but not the interpretation. Now, what about letter C, checking the patient's oxygen levels? Well, measuring the oxygen saturation using the pulse oximetry is a routine task that can be done by nursing assistants or techs, and the RN will still need to analyze the readings and decide whether the interventions are needed. So support staff can gather the data, such as checking the O2 saturation, but the RN must interpret it. Now, what about letter D, drawing blood for the cardiac marker tests? This is about venipuncture, which is a technical skills that trained professionals like phlebotomists or licensed practical nurses can perform. And the RN here doesn't have to be the one to draw the blood, but must review the results. And so this is a skill-based task. It's not a critical nursing, it's not a skill that requires critical nursing judgment. And so we have options letter B as incorrect. We also have letter E, but let's look into letter B first. Why is this incorrect? Well, medications such as the morphine, nitroglycerin, and aspirin require close monitoring for the side effects and effectiveness. And specifically, we have the morphine 2 milligrams IV push. This is a high-risk drug. This will require nursing judgment before, during, and after the administration. And the RN cannot delegate the medication administration to an unlicensed staff. What about letter E? Why is this incorrect? Well, this involves reevaluating a patient, and this is a RN responsibility that requires clinical judgment. And the patient's response to the treatment, let's say pain relief, let's say improved heart rhythm, or let's say worsening of symptoms, require a RN skill. And so the RN is responsible for the client. And this is because they have a better understanding of their initial condition. And the RN is able to observe and also confirm those changes in their health status. So basically they have already the baseline information. And so they can compare what has changed or what has worsened or what has improved. And so this is an incorrect option. So your strategy here is to know what can and cannot be delegated. So think about those tasks that require nursing judgment, assessment, or decision making, and that is the RN responsibility. However, for those tasks that are procedural or technical, this is something that you can delegate to a trained personnel. And think about that this is a cardiac emergency. You have to prioritize critical intervention. So you delegate routine tasks, which will free up the RN to focus on urgent care. And you don't need to be tricked in selecting the administration of medications. Now, if the medications require judgment or close monitoring, this is something that you cannot delegate. And if the question included medications, well, an unassisted personnel or an licensed assistive personnel should not be able to do the medication administration. So think about those considerations. Number 7, a nurse is helping to organize the discharge process for a client. Which of the following steps should the nurse perform? Select all that apply. Options: A, share information with the client's family about local organizations offering support. B, assess whether the client requires medical devices for use at home. C, hand over a record of every medication the client was given during their stay. D, emphasize the value of keeping follow-up visits with healthcare providers. E, supply written instructions on how to take medications independently. So this question tests your understanding about discharge planning, to ensure a smooth transition from the hospital to their home. And registered nurses play a key role in the education to the patient, also ensuring continuity of care and preventing readmissions. And that's why the best answers here are options A, B, D, and E. Now, why letter A? Well, because many patients need extra help after leaving the hospital, and community resources such as home health, maybe support groups or financial aid can make their recovery easier. And families often do not know where to turn. So nurses should connect them with helpful organization. And keep in mind that discharge planning isn't just about the patient. It also includes their support system, and in this case, their immediate family. Now, why is letter B also a correct option? Well, if the patient needs special equipment such as oxygen tanks, maybe walkers or hospital beds, these should be arranged before discharge. And if you fail to do this, this can lead to complications, might end up with falls or readmissions. And you as a nurse in this situation, you have to anticipate the patient's needs at home, and you have to set up medical equipment in advance. Now, what about letter D? Why is this correct? It's because many hospital readmissions happen because patients miss the follow-up care. And your role as an RN should explain why follow-up appointments matter. And this is to help the patient understand when and how to contact their doctor. And also the follow-up care prevents complication, and this will help with medication adjustments. It will also help wound checking and possible ongoing treatment. Now, what about letter E? Why is this also a good option? Well, medication errors are a major cause of hospital readmissions. And patients, especially those on multiple medications, they tend to forget or maybe misunderstand the instructions. And so we need to give them clear written instructions to help the patients take their meds safely and also to follow and be compliant. So as the RN in this case, never rely on verbal instructions alone. You have to provide the patient and their family written guidance or printed instructions to reinforce their learning, and also this will help the caregiver assist the patient. Now, what about letter C? Why is this incorrect? It states hand over a record of every medication the client was given during their stay. Because this is about medication reconciliation, but patients do not need a list of every medication they received in the hospital. Instead, they're going to need a list of the medications they should continue taking at home, or you're going to give them the list about the new prescriptions they need to fill. And you also include those instructions about stopping or adjusting medications. And so patients will require simple, they require clear medication list. They're not going to need a long hospital record that might cause confusion. So you have to be careful about doing this. And so you have to focus on patient safety at home. So the discharge is not just about getting patients about the door. It's about making sure they're safe and supported after they leave. So you have to think about what the patient needs, not just what's nice. So if there's going to be a need for medical devices, of course, this is going to be essential. Now, if you're going to think about a long list of past medication, no, that's not going to be necessary. And part that should be helpful in the discharge is to give the patient written instructions, also verbal instructions, because patients tend to forget up to about 80% of what they're told. And so the written instructions will reinforce learning and also will reduce commission of those errors. And again, I want you to remind you that your role in this scenario is about to be an educator and also a coordinator of their care. So you're going to have to teach, you're going to arrange resources, and also to ensure follow-up care. And you just don't dump those massive information and just leave them in the dark. So final thought here is that with discharge planning, you have to set the patient up for success in their home setting. You have to prepare the patient. And also this can lead to fewer complications, fewer ER visits, and it will promote better recovery. Let's have number 8. A patient in the hospital with stomach cancer declines surgery and chemotherapy, instead inquiring about hospice care at home. Later, the patient's daughter urges the case manager to convince the patient to accept the surgery and chemotherapy. The case manager informs the daughter that this would infringe on which patient right? Options. A, the right to refuse involvement in experimental studies or research projects. B, the right to make decisions regarding their treatment plan. C, the right to autonomy and self-determination. D, the right to anticipate consistent ongoing care. So this question is testing your understanding of patient autonomy and informed decision making. Now, on the NCLEX, it's very critical for you to know that patients have the right to make their own medical choices, even if their families disagree. And so our answer is letter B. And why is that? Because patients have the right to make decisions about their own care, including refusing treatment. And this includes choosing not to have surgery or chemotherapy, and also exploring options like hospice care. And in this scenario, the daughter may disagree, but the case manager must respect the patient's wishes. And so the key point here is that patient can refuse any medical treatment, even if their family disagrees. Now let's look into the incorrect options, such as letter A. Why is this incorrect? Well, this right protects patients from being forced into research trials or experimental treatments. But in this case, the patient is refusing standard treatments, not about research participation. And since there's no experimental study being offered, this answer doesn't really fit. So we are removing this. Now, what about letter C? Why is this incorrect? Well, remember about autonomy. It means the right to make independent choices. However, this term is often linked to advanced directives or like DNR orders or living wills. We know that autonomy is important, but this scenario is more about treatment planning. So this makes option B a much better fit. Now, what about letter D, the right to anticipate consistent ongoing care? Why is this wrong? Well, this right also ensures continuity of care during the transition period, such as transferring patient or discharging patient from hospital to home or doctor to doctor referral. But the patient has not entered hospice care yet. And so continuity of care isn't the issue in this question. The real issue is treatment refusal, not whether the care will remain consistent. And so the patient's concern is treatment choices, not care continuity. And so this is supposed to be discarded. So in this kind of question, you have to focus on the patient's decision-making rights. Again, patients can refuse care, even life-saving treatments, and family members cannot override the patient's wishes. And you have to identify the best match for the situation. You have to look for that option that directly applies to the patient's decision, not a broader concept like research or autonomy. And again, you have to respect the patient's options or choices. So you have to ask yourself, who has the final say in the treatment? Of course, the patient. And again, if you are going to ask is this a research related situation? No. So you eliminate that option. And if you're going to ask, is this about treatment decisions or is this long-term care? Now, you have to choose the treatment decision, which is the now. Okay. So I hope that you're going to consider all those concepts. Let's have number 9. A nurse is getting ready to transfer a client who is 3 days post-surgery to a long-term care center. Which details should the nurse include in the handover report? Select all that apply. A, the client's requirement for specialized tools or devices. B, vital signs recorded when the client was first admitted. C, the client's documented medical condition. D, the kind of anesthesia administered during surgery. E, the status of the client's advanced directives. Now, this question checks your understanding of proper handover communication when you are transferring a patient to a long-term care facility. So this is to ensure that the receiving facility has the right information to continue safe and effective care. And so the correct options here are answers A, C, and E. Why letter A? Well, it's because if a patient needs medical equipment, such as walkers, oxygen, or feeding tubes, the receiving facility must prepare for it in advance. And if you miss this information, this can delay the care. It will put the patient at risk. So you have to mention any medical devices the patient depends on. So that's why we are selecting A. And what about letter C? Well, the receiving facility must know the patient's primary medical conditions in order to provide appropriate care. And this will also help the staff understand the patient's need and also to anticipate the possible complications that can occur in that long-term care facility. So the key point here is that diagnosis, if they know the client's diagnosis, this is the basis for the interventions or the basis how they can provide the care. And so without knowing this, the new facility will not know how to manage the patient. Now, what about letter E? Why is this correct? Well, it's because the advanced directives will guide the medical decisions if the patient cannot speak for themselves. And if a patient has a DNR order, the new facility must know this is the new facility will know this immediately to avoid any unwanted interventions. And so you have to include in the handover the information about advanced directive to respect the client's autonomy and also legal requirements. Now, what about letter B? Vital signs recorded with the client when the client was first admitted. Well, this is all about old vital signs. So these are outdated. And what the long-term care facility requires are the new set of vitals to assess the patient's present condition. And you are going to include the recent vital signs readings, any trends, maybe if it's fluctuating or the vital signs are stable. And if there are any concerns like fever, or maybe hypotension or hypertension, or maybe tachycardia. So these are things that you should be including in the handover. Now, why is letter D incorrect? Well, surgery was done 3 days ago, and so the anesthesia used during the procedure is no longer going to affect the patient. But unless there's any new complications, maybe post-op respiratory depressions or any other complications, this is not to be necessary in your report. What you should report is maybe a lingering post-op issues, maybe pain management needs, maybe wound healing status. Those are the things that you should incorporate in the report. So for this type of question, you have to think about what matters for ongoing care. And so the reporting that is involved isn't just about facts. It is about what the next team needs to know to provide safe care. And so if you're the nurse in this scenario, you have to ask yourself, is the information I'm giving to this person going to affect the patient's current and future care? But if it's not, then it's probably unnecessary. So you have to focus on the current and relevant information. So do not include old vitals. What you're going to do here is to include those current trends in the vitals. You don't have to include the type of anesthesia given. What you're going to do in here is to include the pain management that the client requires. And always report medical conditions, the needed equipment, legal directives, which will protect the patient and the healthcare team from having any errors in miscommunication. So you got to be clear, you got to be concise, you got to be organized. 10. A nurse working on a telemetry floor gets a handover report about 3 patients at the end of a shift. Which patient should the nurse check on first? Options: A patient admitted for monitoring with unusual chest pain but normal cardiac enzyme levels. B, any of the patients, since they all seem to have similar levels of urgency. C, a stable patient recovering from a recent cardiac catheterization. And D, the patient experiencing frequent PVCs, sweating, and stomach upset. So this question challenges your ability to recognize early warning signs of a cardiac emergency. So in the NCLEX, prioritization is based on severity, not admission reason or timing. So the correct answer here is letter D. And why is that? Well, with the presence of the frequent premature ventricular contractions, this indicate ventricular instability. This can lead to lethal arrhythmias like VTAC or possibly ventricular fibrillation. And the sweating and stomach upset are classic warning signs of a silent MI, especially in older adults, women, and diabetic patients. And if you're ignoring these symptoms, this could result in possible cardiac arrest. And what you're going to do here is to check the patient first for further assessment. Maybe you're going to have to do ECG evaluation and possible emergency intervention. So these are subtle symptoms, and so you have to consider the severity of this manifestations. Now, why is letter A incorrect? It states a patient admitted for monitoring with unusual chest pain but normal cardiac enzyme levels. So here are your clues. So again, why is this incorrect? Well, we know that chest pain is always concerning, but with the normal cardiac enzymes, it means there's no active heart damage and the patient is being monitored and is also stable for now. Comparing it to our letter D with the frequent PVCs, which are suggestive of MI, you have to take priority of that one because this indicate that the problem is active and possibly a worsening condition. So take note in option A about the normal cardiac enzyme levels. This reduces the urgency. This will require still monitoring, but then again, the urgency is somewhat lessened, but you don't have to prioritize this over option D. What about letter B? Any of the patients, since they all seem to have similar levels of urgency. This is incorrect because not all patients in the options have the same level of urgency. The client we have in letter D with those manifestations are they have a higher risk rather than over the other patients. And so you have to prioritize this patient. Now, what about letter C? A stable patient recovering from a recent cardiac catheterization. Why is this wrong? Well, the word stable, it simply means that there's no active complication, so this patient is not in immediate danger. We know that the patient has had a cardiac catheterization, but then again, there's no indication of instability. And the client that we have in letter D has more manifestations that signal that the patient may have an impending cardiac event. So in this type of a question, you have to look for signs of immediate danger, such as the frequent PVCs, and also consider about letter A. Since the patient have chest pain, but they have normal cardiac enzyme levels, this is going to lower the priority. And in this type of question, you have to recognize the importance of subtle symptoms. So again, associate these manifestations, sweating and stomach upset, especially with the PVCs that are frequent. This is really, what do you call this? These are reflections of an impending cardiac event. And so you have to prioritize this patient to intervene to perform life-saving treatments. Now, the word stable in the other options here, such as in letter C, this doesn't require immediate intervention. Again, this will lower the priority. Let's have 11. A nurse is attending to a client preparing for a surgical procedure. The client passes the nurse some advance directive document saying, take these. I'm too young to bother with decisions about life support or what should be done for me. What should the nurse do in response? Options. A. Tell the client that the surgery cannot proceed without completing the advance directive forms. B. Arrange for a client advocate to meet with the client and explain the role of advance directives. C. Send the documents back to the admissions office with a note indicating the client is not ready to deal with them now. D. Advise the client that unexpected events can occur during surgery and suggest filling out the forms as a precaution. So this question tests your ability to respect patient autonomy, the use of therapeutic communication, and advocating for informed decision making regarding advance directive. And so the answer here is letter B. Why? Because the client is misunderstanding the purpose of advance directive, thinking they are only for older people or end-of-life decisions. Your role is not to force the client to make a decision, but you have to ensure they understand their options. Now, the client advocate here, it could be a social worker or a case manager. They can explain advance directives in a non-threatening way and can also address the client's concerns. So the key here is that the goal is to provide clarity. You're not going to pressure the client. You have to provide education, which will empower the patient to make informed choices. That's why B would be the best choice. Now, why is letter A incorrect? Well, take note that advance directives are optional. They are not mandatory. A patient can have surgery without completing this document. And so this response is incorrect and also misleading, which damages trust in the healthcare providers. What you should do instead is to offer education. Don't offer ultimatums, because patients have the right to decide whether to complete these forms. And letter C is also incorrect. It's because this response ignores the client's misunderstanding instead of addressing it, and simply returning the forms without further discussion fails to advocate for the client's right to be informed. So what you should do here instead is to ensure the client gets the right information. And so you have to bring in a client advocate. Letter D, why is this incorrect? While technically true, this response lacks therapeutic communication. While when you are saying unexpected events can happen, may increase the client's anxiety. And so this makes them feel pressured rather than being supported. So what you should do here instead is to keep the conversation open and educational. So keep in mind with this type of question, always promote patient autonomy. Patients have the right to accept or decline advance directives, and your role is to educate, not coerce the client. So your best approach in this case is to offer resources like having a client advocate to speak with them instead of making decisions for them. And don't forget about using therapeutic communications, all right? Here, you need to inform the client in a way that respect their feelings and choices. And you have to focus on advocacy and education. And so when a patient misunderstands something, you have to step in and to provide the correct information. And you have to eliminate those fear-based or dismissive answers, such as option D. You have to avoid anxiety-inducing language. And in letter C, you have to avoid neglecting the issue. And in letter A, you have to avoid making false claims. So I hope that gives you clarity about the options. 12. While a nurse is documenting at the nurse's station, one patient activates the call button requesting help to reach the restroom. As the nurse responds, another patient triggers the call system, exclaiming, "I need help now. My IV is leaking a lot of blood." What criteria should guide the nurse in deciding which patient to assist first? Options. A. The nurse could opt to help either patient first, as both situations carry similar levels of urgency and risk to patient well-being. B. The patient reporting to a heavily bleeding IV should take priority. Without assessing the IV, it's unclear whether it's a central or peripheral line, the event of blood loss, or what drugs might be running through it. C. The patient needing a restroom help should be addressed first, as they might try to move unassisted if no one comes, posing a safety risk. D. The patient who activated the call system first should receive attention first, since the IV bleeding is likely not a critical threat. So this type of question is testing your knowledge about triaging and prioritizing. And whenever there's multiple patients needing help, you have to quickly decide who is at greater risk, and you have to act accordingly. And that's why we have letter B as the best answer. Why? Well, going back into our prioritization following the ABCs, airway, breathing, circulation. With this report from the patient, active bleeding affects circulation, which is critical. The IV needs immediate assessment to determine if it is a central or a peripheral line, and you have to determine how much blood is being lost and whether medications, maybe vasopressors or anticoagulants, are also involved. Now, the bathroom request can be delegated, or it can be briefly delayed, whereas the circulation issue requires urgent attention. So the key point in option B is that when you face these two patient needs, you have to prioritize the severity, not the order of the request. Now, what about letter A? Why is this incorrect? Well, the two situations are not equally urgent. The leaking IV with a significant blood loss is a circulation issue that could worsen fast, whereas the restroom assistance is important, but it's not life-threatening. Again, this is something that you can delegate to another person. It could be an assistive personnel. And again, circulation issues take priority over non-urgent safety concerns. That's why we are eliminating letter A. Now let's look into letter C. Why is this incorrect? Yes, we know about the safety risks that the patient may fall, but this is preventable. The patient here can be instructed to wait, or what you can do is to have someone help this patient. And then again, bleeding is an active problem that can rapidly worsen, whereas falls or potential falls are actually considered as a what if. But the IV issue is already an active problem, and that's why you have to prioritize that. And so here you have to prioritize immediate active risks over potential risks such as potential falls. Letter D, why is this incorrect? The patient who activated the call system first should receive attention first. Again, the same reasoning that apply to the other options. In the nursing prioritization, it's not about first come, first serve basis. And if you are assuming that the IV bleeding is minor without assessing it, is dangerous. Even peripheral IV issues can lead to significant blood loss, could lead to infiltration that can be a complication, and possible exposure to harmful medications. So again, prioritization is based on severity, not the time of request. And don't forget using the ABCs. You have to prioritize the circulation issue in this question. And you have to use real versus potential risks rule. You have to prioritize active problems, then possible or potential issues. Now, you have also to think, can I delegate this task? So you have to assess the issue with the IV bleeding. This is a nurse issue, whereas the restroom request can be safely delegated to an assistive personnel or a nursing assistant. So keep that in mind. 13, a nurse manager is monitoring the behavior of a nurse under their oversight. Which of the following actions by the nurse should prompt the nurse manager to step in? Select all that apply. A, talking about a client's health status with someone on the phone who has given the client's designated access code. B, examining the medical chart of a client who is under another nurse's care. C, engaging in bedside rounds where the client details are shared in the hallway outside patient rooms. D, duplicating a client's latest lab results to give to the provider during rounds. E, sharing details of a client's health with the hospital chaplain. So this question is testing your understanding of HIPAA and your ability to identify when a nurse is breaching patient confidentiality or acting within legal or ethical boundaries. And that's why we have options B, C, and D are as the answers. Now, why is letter B correct? Well, take note that nurses should only access records for clients they are directly caring for. Just because a nurse has access to the system does not mean they can look at any patient's chart. This is a clear HIPAA violation. And so keep in mind that unauthorized access to medical records is called snooping, and this can lead to disciplinary action or termination. Letter C is also correct because discussing private patient information in a public space, like a hallway, will risk other people overhearing, and this is also a breach of confidentiality. Even if only healthcare workers are around, HIPAA requires patient information to be shared privately inside the room, not in common areas. So the key point here is to always lower your voice, close doors, maybe use curtains, and avoid public spaces when discussing patient details. Now, what about letter D? This is also correct because printing extra copies of lab results can also increase the risk of the papers getting lost, could be misplaced, or could be seen by unauthorized people. And the provider can access the lab results electronically by themselves without needing a duplicate paper copy. And so this is also the one of the answers. And only print or copy when it's absolutely necessary. And you have to keep in mind to dispose those printed materials securely, such as shredding and putting them in one of those HIPAA bins. Now, why is letter E incorrect? Why? It says actually here, sharing details of a client's health with a hospital chaplain. Well, just because someone is a hospital chaplain doesn't mean they automatically have a right to protect health information. And the patient health information can only be shared with individuals directly involved in the care, such as doctors, nurses, or authorized family members. Now, if the client requested a chaplain visit, the chaplain can see the patient but should not be given medical details without consent. So this is one of the correct answers. So we will include letter E here. So that would be B, C, D, and E. So those are the correct answers. Now, what about letter A? Talking about the client's status with someone on the phone who has given the client's designated access code. Why is this incorrect? Well, we know that HIPAA allows certain people, family, caregivers, to receive information if they provide a client-approved access code. And the access code confirms that they have the authorization, and so the nurse is not violating the HIPAA by discussing the client's health with this person. So that's why this is incorrect. So to wrap up about HIPAA concept, remember that protected health information can only be shared with authorized individuals, and you have to take steps to prevent unauthorized access, whether it is intentional or accidental. And keep in mind to avoid public conversations about patients, and also think about data security, such as printing, copying, or leaving paperwork unattended can lead to data breach. And so you have to eliminate those options that are lawful and ethical in this question, since A is legal under HIPAA regulations. Let's have number 14. A critically ill client has a blood pressure reading of 66/35 mmHg. The healthcare provider has ordered a 500 ml IV bolus of HIPAA to be given as needed if the systolic pressure drops below 100 mmHg. What should the nurse prioritize in caring for this client? Options: A, do nothing immediately but measure the client's vital signs again in 15 minutes to track blood pressure changes. B, start administering the Discharge IV bolus right away to address the low blood pressure and have a colleague notify the client's doctor. C, call the client's physician first to report the low blood pressure and await additional instructions. D, review the details of Discharge thoroughly before acting despite the client's unstable condition and blood pressure of 66/35. Now, this scenario is testing your critical thinking and prioritization. And take a look into the blood pressure of 66/35. Yeah, dangerously low. And this will put the patient at risk for organ failure. So in this case, you have to act immediately to stabilize the patient. And so the answer here is letter B. You have to administer the Discharge IV bolus because, again, the blood pressure is very low. It means that the body isn't getting enough oxygenated blood to the vital organs. And the doctor already has ordered the bolus as needed for the situation. So there's no need to delay the treatment by waiting for more instructions. And also, the word here about delegating a colleague to notify the medical doctor ensures timely communication without holding up life-saving intervention. And so, again, with this type of option, there is already a standing PRN order. So go ahead and administer that. You have to act that, you have to carry out that order and then have somebody notify the medical provider, but not the other way around. Okay. Now, what about letter A? Why is this incorrect? Well, the client may not have 15 minutes, and waiting can also lead to multi-organ failure, could lead to cardiac arrest, and the blood pressure is already a medical emergency. So you have to intervene first. Then you're going to do the monitoring. Now, what about letter C? Call the client's physician first to report the low blood pressure and await additional instructions. Well, again, the client already has an order to receive the HIPAA as needed for low blood pressure. So there's no need to wait for further permission. And every second counts. So if you're delaying the IV bolus to make that phone call, this could lead to irreversible organ damage. Let's have letter D. Why is this incorrect? Review the details of HIPAA thoroughly. There is no time for in-depth research in a crisis. Knowing basics like the indication or the administration should already be part of your preparation. And this is actually delaying on providing intervention to a life-threatening condition. So this is going to harm the patient. So in this type of question, you have to recognize an emergency. You have to act on it fast. So this is a critical situation. You don't wait, you don't delay, you don't overthink. You have to act first to stabilize the client. And you have to follow the nursing process. You have to assess, intervene, evaluate. The assessment, which involves the value of 66/35 blood pressure, it is already done. It is already available. So your next step is to intervene, and you don't wait on calling the doctor. And so do not confuse assessment with delay. So if there is an action needed, do not stall with reassessments or phone calls. Now, you also have to apply act first, notify later rule. So when you have a PRN or a standing order for a life-threatening situation, you have to implement it immediately. And you can call the physician after the patient is stabilized. Or better yet, if you have somebody to call the medical provider, you can also delegate that task. 15. A nurse is looking after a client in critical condition. The client's son mentions to the nurse that the client has a do not resuscitate order established with their healthcare provider. What should the nurse do next? Options: A, add a DNR order directly into the client's chart. B, contact the primary care doctor to confirm if there's an active DNR order. C, take it as given that the client doesn't want resuscitation and do nothing if their heart stops. D, jot a note on the provider's order sheet requesting the DNR be reissued. And so this question is testing your knowledge of DNR policies, your legal nursing responsibilities, and appropriate communication with healthcare providers. And we have our option B as the best answer here. And why is that? It's because a verbal claim from a family member is not legally binding. And so your role as the RN is to verify if there is a valid, there is a signed DNR order on file. And the primary care provider must confirm or reissue the DNR order before it can be reinforced. So until a DNR order is officially documented, the default action is full resuscitation to employ the CPR or to employ advanced cardiac life support. And so your priority here is to clarify the client's code status ASAP to ensure the patient's wishes are respected while also following the legal and ethical guidelines. Now, why is letter A incorrect? Well, You as an RN here cannot write or you cannot authorize DNR orders. And this is something that must come from a licensed provider. Could be the MD, the DO, or the nurse practitioner, or maybe a PA under the guidance of a medical provider. And so entering a DNR order without the provider's approval is actually outside of your scope and practice, and this could have serious legal consequences. So think about the DNR, that it must be officially entered by the provider and should be placed in the medical record before it is legally enforceable. Okay. What about letter C? Why is this incorrect? Well, without a signed DNR order, full resuscitation is the default. Even if the client previously expressed their wishes, nurses must follow official documentation and not follow verbal reports from the family. And if the nurse does nothing during a cardiac arrest without a valid DNR, they could be held legally responsible for failing to intervene. And so the key here is never assume a client's code status based on a family's member's word or just verbal communication. You have to always verify with official documentation. Now, what about letter D? Why is this incorrect? Jotting down a note does not replace direct communication. So this might delay the action if the provider doesn't see it immediately. And in a case of a life-threatening situation, there should be immediate communication. And until the DNR order is confirmed, the nurse must be prepared to provide full resuscitation if needed. So in this type of question, you have to know your scope of practice. You cannot write or independently enforce a DNR order. Only the healthcare provider can do it. And you as a nurse, you should advocate for clarification, and you have to follow legal protocols. And another thing that you have to keep in mind is to always verify orders. If a family member mentions a DNR, do not assume it is valid. You have to confirm this with a provider, and you have to obtain that paperwork, documentation. All right. And also use the chain of command. If the provider is unavailable or not responding quickly, you have to escalate the situation through the chain of command, maybe through the charge nurse or the nurse manager. And you have to prioritize immediate action. So do not ever leave a note, such as doing option D. You have to call the provider to ensure immediate verification. 16. When a nurse requires informed consent for an invasive procedure from a client, what details must they record? Select all that apply. Options: A, the client's blood pressure, pulse, and temperature readings. B, confirmation that the client willingly signed the consent document. C, the name of the healthcare provider who will carry out the procedure. D, evidence that the client is awake and fully aware of their surroundings. E, the client's expressed comprehension of the procedure's details. F, the nurse's discussion with the client about the procedure's potential benefits versus its risks. Now, this question is checking your understanding of what the nurse must document when securing informed consent for an invasive procedure. And you have to remember that your role is not to explain the procedure itself. That is the role of the provider or the healthcare provider. Your role in this scenario is to simply witness the consent process, and you have to ensure the patient understands what they are agreeing to. And so our correct answers here are options B, D, and E. Why letter B? Well, it's because informed consent must be voluntary. It means that the patient was not pressured into signing, and your job is to verify and document that the signature was given freely. So you're only confirming and witnessing the process. Letter D is also correct because a patient must be mentally capable of understanding what they are signing. So if in a case wherein the patient is drowsy, they are confused, or if they are disoriented, the consent is not valid. So The key point here is that alertness and orientation confirm the patient's ability to make an informed decision. Now, what about letter E? Why is this correct? It's because the nurse does not explain the procedure, but they can confirm the patient understands what the healthcare provider has already given. And so this simply means documenting that the patient verbalized understanding, or if they asked for clarification. And so in a case wherein the patient is confused or has several questions or even questions about the procedure, the nurse must notify the provider before consent is signed. Now, what about letters A, C, and F? Why is letter A is incorrect? Well, it's because vital signs are not required for informed consent documentation unless the abnormal vital signs affect the decision making, or maybe low blood pressure causing confusion. They don't need to be recorded. Okay. Now, letter C, why is this incorrect? Well, the provider's name is already on the consent form and the nurse doesn't need to document it separately. Your role is to confirm the patient understands the procedure, not to restate the provider's details. And letter F is also incorrect because explaining the risks and the benefits is the provider's job, not the nurse's. And the nurse can do the reinforcement of the information of what the healthcare provider has given, but your role should not be to give details. Okay. Now, again, if the patient has questions or does not understand the risk and the benefits, you must call the healthcare provider and have them explain it to the patient. Let's have number 17. A nurse is attending to a child in the emergency room who suffered a head bruise after falling. The child resides with a single parent, and the doctor's discharge plan includes waking the child hourly to check for signs of a potential brain injury. Under which circumstance should the nurse step in to provide or to prevent the discharge? Options. A, the child says, "My head aches and I just want to go home." B, the nurse detects the scent of alcohol on the parent's breath. C, the parent expresses anxiety about bringing the child home and asks for an overnight stay. D, the parent mentions they lack insurance or funds for a follow-up appointment. So this question is testing your understanding of pediatric safety, especially with possible head trauma or head trauma monitoring. And so also testing when to intervene in a discharge plan. The answer here is letter B. Why? The child is needing hourly neurochecking. So this is going to require a competent and sober caregiver in order for them to monitor for the signs of worsening brain injury, right? And so if a parent under the influence, their breath smells alcohol, they may not be able to assess the changes. They may not be able to wake the child on schedule or even seek for immediate medical help if needed. And so discharging the child in this situation could be considered neglect. And the nurse must advocate for the client's safety by notifying the provider and possibly involving social services. So your role here is to ensure the child has a responsible caregiver before discharge. Now, why is letter A incorrect? Well, a mild headache or a headache is expected after a minor head injury, and it doesn't necessarily mean the child needs hospital admission. And the focus should be on neurologic symptoms that worsen, such as vomiting, confusion, or a difficulty waking up. And the discharge plan already includes close monitoring. So a simple headache alone isn't a reason to prevent the discharge. And we know that the child's headache is valid, but it doesn't automatically mean discharge should be stopped. Now, what about letter C? This is understandable for a parent to be nervous, but anxiety alone isn't a reason to delay a discharge. And what the nurse can do is to ease the parents worrying by teaching how to monitor for danger signs, and can also provide written instructions on when to seek emergency care. And the nurse can also give direct contact numbers in case concerns can arise when the pediatric patient is discharged at home. And so for this option, the anxiety that the parent is expressing can be manageable when you are educating them, when you are reassuring them, and it doesn't justify keeping the child in the hospital unnecessarily. Now, what about letter D? The parent mentions they lack insurance or funds for a follow-up appointment. Well, we know that financial concerns are important, but they don't directly impact the child's immediate safety at home. The nurse should refer the family to social services for assistance with financial barriers. And a lack of insurance doesn't prevent emergency care, because hospitals must treat patients regardless of their ability to pay. And so when you are going to encounter the same type of question, you think about safety first. You have to think about the child's well-being at home. That should be your priority. And have to ask yourself, can the caregiver or the parent provide proper monitoring at home? Now, if the answer is no, because they are impaired due to the influence of alcohol, then that is a safety concern and should question the discharge process. And also, you have to focus on the nurse's role. Nurses cannot change discharge orders, but you have to advocate for safe conditions at home. And if a parent is unfit to care for the child, your role is to escalate concerns to the provider and to the social services. And in this case, you also have to avoid emotional distractions, such as in option letter C. There's that parent expressing anxiety or lacking money. It doesn't make the home unsafe. It just means they need extra support. All right. Or let's say the child expressing headache or discomfort. This doesn't automatically mean the discharge is unsafe. So what you're going to have to look for in this case, you have to look for that option that suggests immediate danger, especially that the caregiver or the immediate parent is unable to monitor this patient or is unable to carry out what the instructions have been placed by the medical provider. 18. A nurse with under a year of experience complains to a seasoned colleague. The charge nurses keep hovering over me and reviewing how I care for my patients. It feels like they don't believe I can do my job well. Which reply from the experienced nurse shows an awareness of proper staff oversight? Options. A. Why not talk to the charge nurses about feeling mistrusted? They likely don't mean it that way. B. The charge nurses oversee everyone like that. It can get irritating, but I think their hearts are in the right place. C. After assigning patient care, charge nurses are responsible for ensuring it's done safely. The leadership might see their presence as a way to offer you guidance or support. D. Since you're still new, the charge nurses probably think you lack the skills and know how to manage some tasks on your own. So let's go back into the question. And this is testing your understanding of the charge nurse's role in supervising patient care and how to support a newer nurse's concerns without dismissing them. And so the correct answer here is letter C. Why is this correct? It's because charge nurses are not just assigning patients. They also have to make the care provided correctly and safely by the new nurse. And their role is not about mistrust, but also about supporting the staff and to also ensure patient safety. And this response explains why they are present and frames their actions as helpful rather than being critical. So take note that charge nurses have a legal and professional duty to supervise care, not just delegate. So that's why C is the best answer. Now, why is letter A incorrect? We know that encouraging open communication is good, but this response doesn't explain why the oversight is necessary. The new nurse might feel like their emotions are being acknowledged, but they still won't understand the role of the charge nurse. So The better approach is to acknowledge both feelings and facts, and that supervision is part of safe nursing practice. Now, what about letter B? Why is this wrong? It's because this response validates frustration, but it does not explain the purpose of oversight. So saying it can get irritating makes supervision sound like an annoyance instead of an important responsibility. And supervision is not about being annoying. It's about ensuring that patient care is safe. Now, what about letter D? Why is this incorrect? Well, this can also reinforce self-doubt instead of explaining the charge nurse's role. And the focus is only on experience, which could make the nurse feel unsupported or undervalued. Now, take note that supervision isn't just for new nurses. It's part of the quality patient care for everyone. So even seasoned nurses need to be supervised as well. And for this type of question, you have to look for that best response that provides insight into the charge nurse's role. And you have to avoid those options that just validate emotions or downplay the situation. And take note that charge nurses isn't just supervising because they don't trust the staff. They want to ensure patient care is safe and effective. And with the choices here, you have to avoid negative or dismissive statements. And take note of those answers that sound judgmental, and they're never the best choice. Alrighty, let's have number 19. A nurse is mentoring a recently licensed nurse and describing the nurse's responsibility as a client advocate. Which of the following scenarios demonstrate the advocacy role? Select all that apply. Options: A, notifying the care team that a client has chosen a do not resuscitate order. B, helping a client decide on their treatment based on their nurse's own suggestions. C, confirming that a client comprehends the steps involved in a cardiac catheterization procedure. D, outlining care choices for a client with a life-limiting condition. E, alerting others that a team member from the prior shift failed to follow prescribed care instructions. Now, this test question is testing your understanding about advocacy, client rights, and also professional nursing responsibilities. And take note that nurses must support clients in making their healthcare decisions and also ensuring their rights and safety. And that's why the correct options here are letters A, C, and E. Why letter A? It's because advocacy means making sure the healthcare team follows the client's choices. And if a client has decided a DNR order, the nurse must communicate this so their wishes are being honored. And without proper documentation, the client could receive CPR against their wishes in an emergency. And so remember that advocacy ensures the client's voice is heard and their decisions are respected. Now, what about letter C? Why is this correct? Well, the informed consent is a critical part of advocacy, and the nurse doesn't obtain consent, that's the provider's role, but they must verify the client understands what they are agreeing to. Now, if the client is confused, the nurse should ask the provider to explain that again to the patient. And a client must understand the procedure before signing a consent, and advocacy can ensure the informed decision making. That's why that's part of our correct options. Now, what about letter E? Alerting others that a team member from the prior shift failed to follow prescribed care instructions. Now, if a nurse notices a mistake, let's say a missed medication, or let's say incorrect treatment, they must protect it to protect the client's safety. Now, also consider that advocacy includes speaking up when care is compromised, and this is not about blaming. It is about ensuring the client gets the right treatment. And reporting and safe care is part of advocacy. Now, what about letter B and D? Why are these incorrect? No, for letter B, a nurse can educate, they can provide information, but they should never push their own opinions on a client's treatment choices. And with advocacy, it means empowering the client to make their own decision, not making the choice for the client. So your role here as an advocate is to support, not influence, and not create the decision for the patient. Now, what about letter D? Why is this incorrect? Well, it's because discussing and recommending treatments is the healthcare provider's job. It is not the nurse's job. And the nurse can offer emotional support. This can clarify information, and this can also connect the client with the right resources, but they cannot outline medical care plans. So for this question, I want you to remind or to recall the advocacy. Basically, it protects the client's right and safety. And so you have to think about what directly benefits the client and asks if the action can ensure the client's decisions are being followed, and also ask if the decision prevents harm or if it improves care. And you also have to watch for the scope of practice issues. Again, nurses are supposed to support, they're supposed to educate, they're supposed to report, but don't diagnose or make treatment recommendation. Now, if the option involves giving medical advice, it's likely outside your role. Let's have number 20. A nurse undergoes lab and imaging tests ordered by their healthcare provider at the healthcare facility where they work. Out of curiosity, the nurse logs into the hospital's health information system and prints the results of these tests. Do the nurse's actions breach HIPAA regulations? Select all that apply. Options: A, no, there's no HIPAA violation since the nurse can freely access their own medical records as an employee of the facility. B, yes, this breaches HIPAA because the nurse isn't using the information for patient care or necessity. C, no, it's not a HIPAA violation since the tests were done on the nurse's own body and blood. D, yes, this violates HIPAA as the health data belongs to the facility until it's officially released to the nurse by the doctor or requested properly. E, no, HIPAA privacy rules don't apply here because the results pertain to the nurses personally. F, yes, printing the records instead of viewing them online makes this a HIPAA violation. Let's take a look into the options. Now, this is basically testing your knowledge about HIPAA and whether the healthcare worker can access their own medical records through their workplace's system. The answers here are options B and D. Now, let's look into letter B. Why is this correct? It's because HIPAA allows access to health records only when necessary for patient care or an approved administrative reason. And so the nurse here is not acting as a provider in this situation, but as a patient, meaning they must request records the same way any other patient would. And just because you work at the facility doesn't mean you have automatic access to your own records. You still have to follow the rules. Now, why is letter D also correct? Yes, this is a violation. Well, take note that the hospital or the facility manages the medical records until they are officially released to the patient. And the nurse must follow proper channels such as requesting through the medical records and also through the department or patient portal. And just because it's your test doesn't mean you can pull it up whenever you want. You have to wait for the proper release. And so the other options here, such as letter A, C, and E, F, are all incorrect. Let's take a look into letter A. Well, being an employee doesn't mean you can bypass standard procedure, and the system is for authorized use only, and personal curiosity is not a valid reason to access any record, including your own. And letter C, is also incorrect because HIPAA applies to all patient data regardless of who the patient is, and the ownership of the data doesn't matter. What matters here is how the information is accessed, and the correct way to get to the results is through a formal release, not logging in as an employee. Now, letter E is also rather incorrect. It's because HIPAA always applies even if the nurse is the subject of the records. And just because the information is about you just doesn't mean you can access it however you want. And also, the same rules of privacy and security apply to everyone. Now, what about letter F? Why is this incorrect? Take a look about this. It says, yes, printing the records instead of viewing them online makes this a HIPAA violation. Well, this is half correct, half incorrect. Well, it's because the HIPAA violation happens the moment the nurse accesses the records improperly, not just when they print them. And printing, or let's say viewing them without proper authorization, is equally a violation, not just about printing. So the method of access doesn't matter here. If there is an authorized access, this is still a violation. So I want you to keep in mind about these rules. Let's have number 21. A confused client arrives at the medical surgical unit diagnosed with sudden kidney failure. The doctor prescribes the insertion of a hemodialysis line to enable urgent dialysis. The client's spouse hands the nurse an advance directive stating that hemodialysis should not be performed if the client is unable to make clear healthcare choices. What should the nurse do first? Options. A. Ask the client's spouse to discuss with the doctor whether to move forward with dialysis. B. Notify the doctor right away about the advance directive and the client's preference against dialysis and ensure a copy of the directive is filled in the client's chart, or filed rather. C. Get permission from the client's spouse to insert the dialysis line and proceed with treatment. D. Alert the doctor immediately about the advance directive and the client's stance against hemodialysis treatment. The answer here is letter B. Why is that? Letter C. Actually, this is incorrect here. Let's remove that one. This is specifically letter B. That is notifying the doctor right away about the advance directive and the client's preference against dialysis. And make sure that you file that in their chart as well. And why is that correct? Well, the advance directive is a legally binding and it must be followed. So you have to immediately inform the healthcare provider that the prescribed treatment is conflicting with the client's documented wishes. And so when you are filing this document into their chart, this will ensure that all healthcare providers will respect the client's decisions, and also ignoring the advance directive could be considered as battery, which is basically performing medical treatment without consent. So your role here as the nurse is to advocate, to make sure that medical care follows the client's legally documented wishes. Now, what about letter A? Why is this incorrect? Ask the client's spouse to discuss with the doctor whether to move forward with dialysis. Why is that? Well, the nurse, not the spouse, is responsible for acting on the advance directive and also to ensure the care team follows it. And this option also can delay the action, and it will also place unnecessary stress on the spouse. Take note about the keyword here, client spouse to discuss with the doctor. Yeah. So you're actually placing or delegating the spouse to speak with the doctor, even so you have already seen the advance directive. And so you must take responsibility and notify the doctor immediately and Again, this is not a decision for the spouse to negotiate. Now, what about letter C? Why is this incorrect? Get permission from the client's spouse to insert the dialysis line and proceed with the treatment. Well, remember that the spouse cannot override the advance directive unless they have a legal authority, such as a durable power of attorney for healthcare decisions, and proceeding with a treatment that contradicts the directive will violate the client's legal rights, and it could result in legal consequences for the entire healthcare team. So your role here should be to advocate for the client's wishes. You don't want to seek permission to ignore them. Now, what about letter D? Why is this incorrect? Alert the doctor immediately about the advance directive and the client's stance against hemodialysis treatment. Well, notification to the doctor is the right step, but this option somewhat leaves out a crucial action, such as filing the directive in the client's medical record. So that's basically what's lacking here. And without proper documentation, the other healthcare providers may not know, or they might proceed with the dialysis against the client's wishes. So you have to ensure that the advance directive is on the client's record to inform the entire healthcare team involved. All right. So in this type of question, you have to consider that client's rights always come first. And if the question involves client's legal healthcare choices, the correct option will always focus on honoring the patient's autonomy, and the advance directive must be followed. And your role here as a nurse, you should take immediate action. You have to watch out for those options that shift responsibility to others, such as in letter A. And you as a nurse advocate should communicate directly to the medical provider. And do not assume family members can make decisions. So the spouse does not automatically have legal authority over the client's healthcare decisions unless they have been designated as the healthcare proxy. All right. So if an advance directive exists, the healthcare team must follow that one, not the spouse's wishes. 22. A nurse notices that a newly prescribed medication listed in a recent order matches an allergen on the client's allergy list. Acting as the client's advocate, what steps should the nurse take to protect the client's well-being? Select all that apply. Options. A. Verify the client's wristband allergy information against the allergies recorded in their chart. B. Proceed with giving the medication as directed, documenting its schedule and doses. C. Consult the pharmacist about the severity of the allergy before deciding on next steps. D. Promptly alert the healthcare provider that the prescribed drug is one the client is allergic to. E. Stop the medication from being listed on the client's administration record. E. Urge the client to try the medication while monitoring them for any adverse effects. The answers here are options A, D, and E. Why A? Well, the client's allergy list should always be double-checked before giving any new medication. And we know that mistakes can happen in documentation or maybe the entry of the order. So you have to verify the wristband and chart records in order to catch any errors before they reach the client. Right? So what you're going to do here as a nurse, you have to use two sources of identification before you administer any medication. You have to ask the client's name and also ask the birthday while checking the patient's bracelet. And letter D is also correct because the doctor needs to be notified ASAP so they can change the prescription before the drug is given. And always remember that delaying this step can put the patient at risk for an allergic reaction, and this could be life-threatening. Letter E is also correct because if the medication remains on the administration record, another registered nurse might give this drug by mistake. And so if you are removing this medication, this can ensure that there's no one accidentally administering this drug. So preventing even the possibility of an error is a critical part of client safety, and that is why this is one of our correct answers. Now, what about B, C, and F? Why letter B is incorrect? It's because when you're giving a medication that the client is allergic to is a major safety violation, even if the dose is scheduled, it must not be given. It can harm the patient. Now, what about letter C? Consult the pharmacist. Well, we know that pharmacists can provide additional information, but this should not delay notifying the physician. The medical provider should be the one who must change the order. And if you are waiting on the pharmacist, this could significantly waste valuable time. So take note that you should always go directly to the provider first when an allergy conflict is being detected. Now, what about letter F? Why is this incorrect? It is because an allergic reaction can be unpredictable. It could be severe, could be life-threatening, and monitoring the client after giving an allergen is being reckless. You're putting the client in unnecessary danger. And so the correct action is to prevent the reaction and not manage it after the fact. So for this type of question, you have to focus on the client's safety. And when in doubt, always pick the safest option. So you have to protect the client from any harm, even if the medication is ordered, and you have to follow the chain of command. If the allergy conflicts require immediate communication with the physician, you don't wait on the pharmacist to test for the reaction, all right? And you, as a nurse, cannot change the order. What you can do is to stop a harmful medication from being given. Let's have number 23. A client submits a durable power of attorney for healthcare, naming their nephew to make healthcare decisions if the client becomes unable to do so. According to the durable power of attorney, what role does the nephew have? Options: A, individual accountable for paying the client's medical expenses. B, closest legal relative. C, representative authorized to decide on healthcare matters alone. D, substitute decision maker for both healthcare and financial affairs. So this question is testing your understanding about the advanced directives, surrogate decision maker, legal responsibilities when the client cannot make their own healthcare decisions. And so the answer here is letter C. Why? Well, it's because the durable power of attorney for healthcare is a legal document that can allow a client to choose someone, they're called as healthcare proxy, to make healthcare decisions if they become unable to do so. And this role only applies to healthcare decisions. It does not cover financial responsibilities or to make the proxy the closest legal relative. And so that is our best option. Why is letter A incorrect? It says individual accountable for paying the client's medical expenses. Like I have said earlier, the durable power of attorney for healthcare does not make the proxy financially responsible for the client's medical bills. The financial liability depends on insurance policies. It depends on the contracts or the legal financial agreements. It's not on being a healthcare decision maker. And the key point here is that being a healthcare proxy does not mean you're going to be the responsible person to pay for the client's bills. Now, letter B, why is this incorrect? Closest legal relative. Well, the DPOA for healthcare is not going to change who the client's next of kin is. The closest legal relative could be the spouse, could be the parent or the child. They still have certain legal rights, but they do not automatically gain medical decision-making power unless they are named in the advance directive. And so the document about the durable power of attorney for healthcare names a healthcare proxy, but it does not change legal family relationships. Letter D is also incorrect. It's because the durable power of attorney for healthcare is a separate document from a general financial power of attorney. And the healthcare power of attorney only covers medical choices, while a separate financial power of attorney would be needed for handling the money, paying the bills, or managing the assets. And so you have to understand the scope of legal documents in this case. Again, the durable power of attorney for healthcare is only for healthcare decisions. Again, it doesn't cover financial matters or legal kinship. 24. Which of the following statements accurately describes advance directives? Select all that apply. A. Advance directives must be included in the client's healthcare file. B. Advance directives serve as recommendations for treatment only if the client's family considers them appropriate. C. Advance directives outline a client's healthcare preferences in case they can no longer make decisions. D. Advance directives hold legal authority. So the answer here is answers. There are actually 3 answers here. That's options A, C, and D. Why A is correct? Well, an advance directive isn't in the medical record. So if it's not in the medical record, rather, the healthcare providers may not follow simply because they don't know it exists. And having it on file can also ensure the care team has a clear guidance on what the patient wants. And again, if it's not documented, it didn't happen. And so we have letter C, another correct option. Advance directives outline a client's healthcare preferences in case they can no longer make decisions. Yes, the advance directives are written while the person is still mentally capable. So they can express what treatments they want or what they don't want in the future. So the advance directives can only take effect when the client is unable to communicate or make medical decisions, such as when they go into a coma or they will have severe dementia. Now, letter D is also one of the correct options here because the document is legally binding. It means healthcare providers must follow them unless there's a legal reason not to, or maybe there are missing signatures or possible state laws. And the advance directives can help protect patients from receiving unwanted treatments, and this can ensure that the healthcare providers can honor the patient's choices. Now, why is letter B incorrect here? It states advance directives serve as recommendations for treatment only if the client's family considers them inappropriate, or appropriate rather. Well, take note that the advance directives belong to the patient, not to the family, and family members cannot override what the patient has legally decided. And if the document is valid and has legally executed, the healthcare providers must follow that, regardless of the family opinions. Let's have number 25. Which of the following are properly classified as advance directives? Select all that apply. Options: A, final will and testament. B, durable power of attorney for healthcare. C, patient's bill of rights. D, living will. E, do not resuscitate order. The answers here are options B and D. Why? Well, it's because B is, it says here, durable power of attorney for healthcare. This is a document that legally appoints someone, we call them as healthcare proxy, to make medical decisions for a person if they become unable to decide for themselves. And it is an advance directive because it ensures medical choices that will align with the patient's wishes, even when they cannot communicate. Now, letter D is also correct. This is the living will, because the living will outlines specific healthcare choices for situations like maybe a terminal illness or permanent unconsciousness. And it is also a form of an advance directive because it helps guide the doctors and family members when making those medical decisions. And we have letters A and C and letter E as incorrect options. So let's take a look into letter A, final will and testament. Why is that incorrect? Well, a will is about distributing property and assets after someone dies. It has nothing to do with medical decisions while the client is still alive. And since advanced directives apply to healthcare while a person is still living, this doesn't really qualify. Now, what about letter C, Patient's Bill of Rights? Well, this is something that explains what protections and what choices patients have, like the right to informed consent and privacy, and it's not a legal document that guides medical treatment decisions when a person is incapacitated. And so eliminate this one. Now we have letter E as one of the incorrect options. This is the do not resuscitate order. Why is this wrong? Well, a DNR order is a medical order that is placed or ordered by a physician based on a patient's wishes, or let's say discussions with a healthcare proxy. And even though it reflects a patient's preference, it's not a standalone advance directive because it's not a legal document created by the patient in advance, like a living will or the durable power of attorney for healthcare. Instead, the DNR order is an outcome of advanced care planning that is implemented by a healthcare provider. And so take note that advance directives are limited to patient-initiated legal documents, such as living will and durable power of attorney for healthcare, not physician orders like a do not resuscitate order. Alrighty, so great job, everyone. That wraps our review on the management of care. And remember that management of care is a high priority NCLEX topic because it reflects real life nursing decision making. So what you're going to need to do is to think critically. You have to follow legal and ethical guidelines, and you have to put patient safety first. And I want you to keep practicing. You guys stay confident, and you'll master these concepts in no time. So I'll see you again in our next session.